Hello, my name is Dr. Erin Triplett. I'm a physician and scientist in Rochester, Minnesota. Currently, I'm a pediatric neurology resident, meaning that I specialize in diseases of the brain in children. Before we begin, I'd like to thank Dr. Hawes and the Honors Program for inviting me to speak. It is truly an honor, though I certainly wish I could be there with you in person. I'll begin today with an assignment for you, and to set the scene, imagine you're in London, England, the year 1942. It's a grim part of World War II. The Axis powers have advanced throughout Europe. Britain is just trying to hang on through the nightly airstrikes. At this point, the outcome of the war is far from certain. Of course, the Allies and England are fighting back with their own airstrikes against Germany, and this is where your work begins. As a researcher with the Naval Air Force, you're assigned to improve the fighter plane design to keep your planes from being shot down. This improves the success rate and, of course, gets your pilots home safely. Good research requires good data, so you get to work right away, painstakingly mapping out all the bullet holes and broken bits. This labor intensive process allows you to identify a clear pattern of where damage is most likely to occur on your planes. So now the solution seems obvious. You reinforce the parts of the planes which are most likely to experience damage. Of course, being a smart scientist, you also run this data and your conclusions by many of your colleagues for their input. And this is when one of your fellow researchers starts pointing out the literal and figurative holes in your conclusion. After all, he points out, you can only assess damage on planes that make it back to base. Your map actually shows the places that a plane can sustain damage and keep flying. The correct suggestion would be to reinforce the areas where you don't see holes. Now, this is a true story. Statistician Abraham Wald did point out this logical fallacy to the Allied researchers, and they did armor these key places of the planes to great effect. In the decades since, this has become one of the most commonly cited examples of survivorship bias. Though I personally find the discussion of which type of bias less compelling than the example of how important discourse and disagreement is to the scientific process. In reality, there were dozens of people, whole teams of researchers, who had assessed the same data and come to the same wrong conclusion. If the team had not sought out different areas of expertise and then been willing to listen and to adapt to this differing set of opinion, who knows how many resources would have been wasted without improving the survival of Allied forces. Disagreement is critical to good research, not just of warplanes, but technology, medicine, all the areas that we rely on for advancement. And yet, as we have seen the scientific process play out public as never before through these past few years, this iterative cycle of arguing, refining, reinterpreting, amending rarely inspires confidence. After all, if experts can't agree within their own field, why should any of us trust them? But this process is, in fact, crucial, and to illustrate its necessity, I'd point to a more recent example, that of Elizabeth Holmes, who was recently convicted on several counts of fraud in relation to her company, Theranos. Theranos was founded on claims to have developed a technology that could run dozens of standard lab tests from just a few drops of blood. And there was enough there that the company quickly expanded, being valued at billions of dollars, gaining major investments from the uber successful generals, heads of state, even hospitals and national corporations like the Cleveland Clinic and Walgreens. So, what caused all of this to unravel so thoroughly and so quickly? Our large part of this was the absence of a rigorous scientific discourse. Scientists and medical professionals started raising questions as to why they weren't seeing Theranos represented at their scientific conferences or in peer reviewed literature, both of which mandate a back and forth evaluation process. In addition, whistleblowers within the company became fed up that their concerns were repeatedly silenced. This is perhaps a simplification of a complex situation, but this refusal to engage criticism, both within and without, is a key factor in the downfall of Theranos, and also likely hindered them from making real progress. Because real progress is possible. Although we don't have the technology claimed by Theranos, we do have the ability to run dozens of tests from just a few drops of blood, providing crucial, life saving information that allows doctors to treat disease before it causes harm. This science fiction sounding tech has been around since the 1960s. It is, in fact, so common, it's done over 10,000 times a day in the US alone. I'm talking about newborn screening. If you or your child was born in the US in the last 60 years, you've almost certainly been through this process. Newborns in the hospital have a little pinprick on their heel, and a simple paper card is used to collect about 5 drops of blood. From this tiny sample, medical labs are able to screen for more than 5 dozen potentially fatal conditions, diseases which, if found early enough, physicians and families can treat before permanent damage is done. And this is not an exaggeration. As a child neurologist, one of the worst diagnoses that I can give a family is to tell them that their child has spinal muscular atrophy, or SMA. This is a genetic condition that causes the nerves that control the muscles of our body to slowly die off. Children born with SMA at first appear perfectly healthy. It's not until about 6 months of age, when a healthy child is just starting to play and smile back at their parents, that these kids start to seem a little bit more weak. They're perhaps not developing skills quite as rapidly as some of their other peers. And this disease continues to progress until these children become entirely paralyzed. They need feeding tubes because they can't swallow, then ventilators because the muscles of their chest are just too weak to breathe. By the age of 2, this most severe form of SMA was universally fatal. There was nothing that medicine could do. There's no treatment, no surgery, no therapy, nothing to even slow down this process of destruction of the nerves and muscles of these children's bodies. Parents watched helplessly and then had to decide if they'd have another child, knowing that there was a 1 in 4 chance they'd go through this same nightmare all over again. Until about 5 years ago, when the first clinical trials showed that a gene therapy called Spinraza radically changed the course of SMA. Then within another year, another drug delivered by modified virus was also approved. Almost overnight, it seemed that an incurable condition was drastically changed. Today, these first kids to receive these therapies are 7 years old, running, playing with their first grade class. SMA has gone from the worst possible diagnosis to, at least most of the time, a manageable condition. We've gone from saying, "I'm sorry, but there's nothing that we can do," to saying, "Let's talk about the different available treatment options." But even at its best, science is limited. The treatments for SMA work like pressing pause on the disease, stopping progression, but they can't reverse the damage that's already been done. For SMA, if treatment isn't started before 2 months of age, the treatment isn't all that effective. If you've been paying very close attention, you may have spotted the problem. SMA, even in its severe forms, doesn't show up until about 6 months of age. This is months too late to successfully intervene with treatment, which is exactly why the early detection that's only possible with newborn screening is so critical to successful treatment of this disease. And yet, since newborn screening is left to the discretion of individual states, there's still about 25% of states, those shown here in the darker blue, that have yet to add SMA to their panel, meaning over 500,000 kids born each year are falling through the cracks. In Minnesota, where I currently live, newborns are screened for a total of 61 disorders, including SMA. Nebraska, the panel only includes 37. And the differences don't stop there. 2 out of every 5 children in the US has their health insurance coverage through Medicaid, again, which is controlled and regulated on a state level. This has resulted in wide differences in how many kids with SMA can get coverage and the process that families have to go through to get the right therapy. Therefore, how long it takes for these babies to get the right treatment. More concerningly, states, including Oregon, have recently proposed legislation that would severely restrict coverage for current and future gene therapies. Now, these drugs are eye-wateringly expensive. And as we continue to develop novel therapies, we will have to find solutions to covering the expenses and the cost of these medications. However, I would argue that denying coverage for gene therapy is short sighted and means that all but the wealthiest children will die preventable deaths. This is not an acceptable answer. Our ability to care for children should not be tied to the state where that baby happens to be born. With simple screening tools already in place, we could be finding babies with fatal diseases and providing life-altering treatment before it's too late. We can learn a lot from a single drop of blood. Thank you for your attention.